my name's David Neal, one of the consultant gastroenterologists based here on Cookmere Ward. Well, welcome to the department. Hope anyone working here has an enjoyable time. There are 4 consultant gastroenterologists in the gastroenterology department that work on the wards. From the consultant's point of view, we do 1 month on the wards, then 3 months off. So in any 4-month rotation through gastroenterology, you'll get experience of working with each of us for 1 month. We're lucky in gastroenterology, we've got quite a large team of junior doctors, so there are F1, F2, 2 CT training doctors and either 1 or 2 registrars. So if you're worried at all about not having enough support, then don't be, because there's always a fair number of junior doctors around.
Hi, so my name's Daryl. I'm an F1 on gastro at the moment. That usually means getting into work at about 8:30, preparing for our ward round, which usually starts about 9, 9:30, and then helping with the consultant on that ward round for the morning, having some lunch and then completing the task for that ward round in the afternoon.
Hi, my name is Dr Nicholas Davison and I am the Junior Clinical Fellow of Gastroenterology at Eastbourne District General Hospital. I started my journey here as a core medical trainee on the gastroenterology wards and found it to be very supportive. I made my decision that I wanted to be a gastroenterology registrar, and actually the consultants have really helped me and given me an outer training type of programme to help me get into registrar training. I've just completed the interview and I've been accepted into a job.
As an F1, the rota means you do maybe 1 week of on-calls a month and 1 weekend of on-calls a month, and depending on your role would depend on what jobs you need to do in those on-calls. Some can be very busy, but you normally get about a day off in the week to compensate you for that on-call, or a long weekend, which is good. And we normally do 1 weekend of nights in a rotation, so every 4 months, which again is useful to get that experience too.
CMTs do about 1 in 5 or 6. It works in blocks, so you have 5 days when you're actually doing on-calls in 1 block. And then you go back to your ward, and the advantage of that is that you can actually really get into your acute medicine and see similar patients, so you get repetition of those patients. And actually when you go back to the ward, you get in your specialist ward in gastroenterology, you have repetition with regards to those patients, and actually you're not going back from acute medicine to gastroenterology to acute medicine to gastroenterology. So I think there's more continuity with regards to training now.
In terms of clinics, most junior doctors, F1s, F2s, are welcome in clinics, but often the pressure of the ward is such that the timing is difficult. But for the CT training doctors, yes, it's very much something that we would support, and time should be set aside for attendance in clinics.
My name's Catherine Watchman. I'm the matron of general outpatients here at Eastbourne Hospital. General outpatients, we have all the medical specialities and about 5 of the surgical ones. We have a lot of gastroenterology clinics here across the week, a lot of different consultants and registrars alongside them. We also have a FibroScan clinic.
Hi, I'm Karen Harding. I do the FibroScan clinic in the outpatients department. This is nurse-led with a hepatology nurse as well. And what I do basically is FibroScan patients' liver to see the stiffness of livers. This is hopefully so that they don't have to go and have a liver biopsy.
In regards to endoscopy, I have a specific nurse endoscopist who trains me 1 endoscopy list a week, who supervises me throughout the entire thing. And I'm part of the JAGS and JETS endoscopy programme, which is the official mechanism to evaluate how you're doing in endoscopy. And each week we do an appraisal and she looks through what we've done, and then I add those to my JAGS list. So I'm building up a logbook which is officially recognised.
Hello, my name is Danielle Lloyd. I'm the endoscopy matron for Eastbourne Endoscopy Unit. We have a purpose-built endoscopy unit that is 4 years old. We offer a variety of procedures here, ranging from gastroscopy, colonoscopy, flexible sigmoidoscopy, ERCPs. We do a respiratory list, and it's very exciting times that we've just started doing an e-bus service here. We have 3 procedure rooms, so it's very busy. We're an active training unit, and we welcome new doctors to the unit to come and have a look around. We're a friendly bunch and welcome you to the unit.
The hospital teaching-based programmes, which run throughout the year for the F1, F2 doctors and the CT training doctors. Registrars have their own sort of teaching programme, which does take them out of region a little bit more. Within gastroenterology, we've got a sort of a Monday afternoon session which is doubles up as either an MDT to discuss problem patients on the ward. It can be used as a teaching session as well, so that's fairly flexible for juniors to attend and participate in. There is the grand round on a Monday lunchtime, which is open for the whole hospital, where interesting cases are presented. And then again in gastro, we have our upper GI cancer meeting on a Friday morning, which is where we discuss the more problem gastroenterology cancer cases, some of which will be patients on the ward, and that's another sort of learning experience.
Every other week we actually do a specific radiology meeting where we go through all the images from the complex inflammatory bowel disease cases, and the radiologist talks us through it. So that's again a great opportunity for us to learn. I have a mentor with Dr. Eastbourne who does regular meetings with me every couple of months really, but everything's very informal and everyone's very friendly, so I feel like the doors are always open on the corridors of the Secretary's office.
We have teaching once a week for about an hour at lunch. Sometimes that teaching can be a bit longer. There's also the opportunity to do simulations, which you have to do in the year. And depending on the rotation you're on, there can be lots of other teaching opportunities at lunchtime, and the consultants can be quite keen to give you that extra teaching as well.
This year the education department has given me the opportunity to get involved in lots of teaching, which is an area of my career that I want to develop. And they recognise that and have harnessed that and nurtured that, so I've taken full advantage of that. So I've been giving gastroenterology lectures with the guys of my seniors in a 5-week block. 1 week you talk about IBD, the next week you talk about liver disease, the next week you talk about dyspepsia, the next week you talk about hepatitis.
There are regular audits running both on the ward level and also via endoscopy. So for example, endoscopy audits will run rolling programs on upper GI bleeds, audits of endoscopies in patients with cancers. At the ward level, there's any number of audits available really if people want to look at length of stay, management of GI bleeding patients. From the registrar point of view, they're here a little bit longer. They're generally for a year, so there is a chance sometimes to take a slightly more in-depth look at a research project. There's a few national trials of liver disease and gastroenterology disease which we are recruiting patients for, so that's something that we're happy for the registrars to get involved in whilst they're here.
Hi, my name is Agnes Curtis and I'm one of the medical admin. I deal with all the junior doctors and consultants, annual leave, study leave, and any other swap shifts, anything concerning about the rota. And this is the system we're using, the health roster. You can find me on the first floor, medical corridor, opposite line ward. Thank you, bye.
It's all really done through Dr. Eastbourne, who's the lead on this, and through the health roster system. So 6 weeks notice needs to be given, and we look at the health roster system, and then everyone gets access to that. And also we actually keep up to date regularly as a team to see how much availability is there for the ward.
I think one of the things I'd really like to have known before I started here was how supportive the registrars can be, especially when you're on call or when something happens on the ward if you're on your own, that you feel a little bit out of your depth. If you're thinking about calling for support, call for it. They will come, they won't get angry, and they will help you and they'll teach you as well at that time.
If there's a new doctor starting out, that being nervous is understandable and a normal part of starting a new job really. So the nice thing about the ward here is that there are several junior doctors who've been there within the last few years and they're very supportive. The nursing staff on the ward are very friendly as well. The nurses are very experienced and will be able to help and give advice. And there's always a registrar on hand, there's always consultants in the building as well. So I think the main message is if you're not sure, just ask.
Hello, my name is Ros Thompson. I'm matron here on Cookmere Ward at Eastbourne Hospital. Cookmere Ward is a 21-bedded gastroenterological ward, and I think you will find our nursing team very supportive here with your placement.
Hiya, I'm Charlotte, one of the medical secretaries for gastroenterology. Down our corridor you will find all the consultants and also Agnes, our gastro administrator, who will deal with any annual leave or rota movements. We are based on the first floor opposite Blind Ward.
Generally, it is a busy job, I won't lie about that, but it's enjoyable. The experience that junior doctors get from F1 through to registrar level is very good. The feedback we've got from the juniors in recent years has been very positive and they feel well supported.
I've really enjoyed my time as an F1. I've learned a lot. I think you'll learn what you learnt in med school again in the space of a year, which is good. and the responsibility you get is good, and the support you can get from the senior staff when you need it is there too.
So what the Eastbourne Gastroenterology Department has provided me this year is an avenue into a registrar training, which I'm incredibly grateful for. So the support of the team, including the nursing staff, the consultants, the clinical work within the outpatient clinics, which have given me the opportunity to do 3 a week, and also an endoscopy training list once a week, has given me put me in a brilliant position to develop my career and achieve my passion, which is actually to become a gastroenterology registrar.
For those of you coming to gastroenterology, welcome to the department, welcome to the team. It is a friendly unit, it's busy, but it's very supportive, and you should all have a very enjoyable time.